Assalamu alaikum. We're continuing with the same case where we are checking for the problems of an ill-fitting denture. So the first time it was very thick. The denture means the rubber material meant that the denture was not fitting. We adjusted high spots, it became more thin. If you can just move it please with your hand. See how thin it is, and it's even there is a shadow in between. And we also found some heavy spots on the fitting surface, so we adjusted them. Then inside the patient's mouth we adjusted some overextensions further, and then we done centric occlusion, and now this is the result of eccentric occlusion. Okay, so how do we read this? Eccentric occlusion, the functional cusps and the non-functional cusps should have the same color. The functional cusps of the lower, what are they?
They are the buccal.
They are the buccal. Are the lingual cusps taking the bite as the same as the functional cusps?
No.
What does this mean?
This means the load
On excursion.
On excursion, there is uneven contact or unequal contact.
That means, yes, as well as there might be incorrect curve of Wilson. Do you remember that the lower cusps should hug the upper palatal cusps? Huh?
Yes.
So this curve of Wilson might be incorrect, unless we're doing monoocclusion or lingualized occlusion. Yes. Okay, I would accept that the buccal cusps are hitting here, taking that the non-functional cusps here are only touching. But what do we have? We also have uneven contacts with the upper. You see that the 6 and 7 on the left side, okay?
Yes.
My left, that I'm seeing, which is the right of the patient. Yes, the right of the patient. These two teeth are not taking any bite. So?
Yes.
They're taking very light on the 7, something equal on the 6. Now this, what we see on the 6 is what we should see on all teeth. Contact, even contact, functional cusp, non-functional cusp at excursions. Okay? Now go to the premolars. What do I see on non-functional cusps?
On the non-functional, there is a contact, heavy contact.
Heavy contact,
yes.
Okay? So the non-functional, especially on the 5, I'm going to reduce it. We also see on this side, this is more equalized. I will accept this here. Okay? Yes. This is more equalized on this side. The buccal and the lingual are taking the same heavy spots. Okay? Now, go to the anterior protrusion. Only the canines are taking a bite. If I go here, that means that these teeth are not equally taking protrusion movements. See, the canines have a dot, and there's a very heavy dot on the central.
Yes.
So that means the protrusion is concentrating on 2 points, and this will help dislodge the denture, which is the complaint of the patient. So what are we going to do here? I'm going to ask you to reduce the bite on the canine and a bit more on the central, until I have in protrusion all anterior teeth sliding in the same amount,
yes,
without any heavy spot, and they are all light. The centrals here are not taking any bite, so they are not aiding in balanced occlusion. Now, once going back here, functional cusps on the lower alone are acceptable if I'm doing lingualized occlusion, something similar to lingualized occlusion. But still, they should have even marks on the upper. So if I'm using the buccal cusp of the lower as the cusp taking the bite, they should not have uneven bites here.
Yes.
There is another way of doing lingualized occlusion, making the palatal cusps of the upper biting on the lower. There I should have all of the functional cusps with dots, and the lower having even dots. But in this case, we are using the opposite, where the lower functional cusps are the main functional cusp.
Yes.
They should have very smooth guidance left and right. I should not have heavy spots on the upper. Okay?
Yes.
So what am I going to do here? I'm going to reduce the heavy bites on this upper right side of the patient, and I'm going to leave these here because they are equal, but here they are not equal. Okay?
Yes.
And the canine, the dots on the canine, I'm not going to change them here. I'm going to change them in the lower.
Yes.
Okay?
Yes.
To observe or keep the morphology of the teeth, and as well keep their position. So all of the adjustments I'm going to do them on the lower until I see all anterior teeth having a bite that's light and equally distributed. Okay? This is in protrusion. Thank you very much. And once you finish all your adjustments, remove the old colors, everything, wipe everything away with an alcohol swab, and then repeat the excursive movements. Okay. Here in excursions, we don't touch functional cusps because they are already establishing the bite. Yes. That were done in centric. This is why in eccentric we work on non-functional cusps and in protrusive on the lower anterior. Thank you.